These nose drops are used to temporarily clear up a stuffy nose that's caused by things like the common cold, sinusitis, hay fever, or allergies. They work by making the blood vessels in your nose smaller, which helps reduce swelling and congestion. You can use these drops when you need some quick relief from a stuffy nose, but make sure to follow the recommended dosage and timing instructions on the label. When using Ephrine nose drops, it's important to follow the instructions carefully. Make sure to wash your hands before applying the drops to avoid contamination. Gently blow your nose before using the medication, and tilt your head back while sitting or lying down. Hold the dropper over your nostril and apply the directed number of drops, keeping your head tilted for a few minutes. Repeat these steps for the other nostril if needed. It's essential to not use more medication than directed, as it only provides temporary relief. Using it for more than 3 days may cause rebound congestion, leading to long-term redness, swelling, and increased runny nose. If this happens, stop using the medication and consult your doctor or pharmacist. And be sure to inform your doctor if your condition worsens or lasts after 3 days. Some possible side effects of using Ephrine nose drops include temporary burning, stinging, dryness in the nose, runny nose, and sneezing. If these effects persist or worsen, it's important to consult your doctor or pharmacist. Your doctor has prescribed this medication because they have determined that the benefits outweigh the potential risks. Most people using Ephrine nose drops do not experience serious side effects. However, it's important to seek medical attention if you experience any serious side effects, such as changes in heartbeat, dizziness, nausea, headache, mood changes, trouble sleeping, tremors, excessive sweating, or weakness. Additionally, if you notice any signs of a serious allergic reaction, such as rash, swelling, severe dizziness, or difficulty breathing, seek immediate medical help. It's important to note that this is not a complete list of potential side effects, so if you experience any other effects, be sure to contact your doctor or pharmacist. If you are in the U.S., you can report any side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before using Ephrine nose drops, it's important to talk to your doctor or pharmacist if you have any allergies to this medication or other similar medications. It's also important to let them know if you have any underlying health conditions such as heart disease, overactive thyroid, diabetes, high blood pressure, or difficulty urinating due to an enlarged prostate. If you are planning to have surgery, make sure to inform your doctor or dentist about all the medications you are currently taking, including prescription drugs, non-prescription drugs, and herbal products. If you are considering using Ephrine nose drops for your child, it's best to check with your doctor or pharmacist to see if it is safe for children. If you are pregnant, use Ephrine nose drops only if it is clearly needed and after discussing the risks and benefits with your doctor. Similarly, if you are breastfeeding, consult your doctor before using this medication. When using Ephrine nose drops, it's important to be aware of potential drug interactions. It's crucial to keep a list of all the medications and herbal products you use, and share it with your doctor and pharmacist. MAO inhibitors, such as isocarboxazid and linezolid, should be avoided while using Ephrine nose drops, as it may cause a serious and possibly fatal drug interaction. It's important to consult with your doctor about when to start or stop taking this medication, and avoid taking MAO inhibitors for at least 2 weeks before using Ephrine nose drops. If someone has taken too much Ephrine nose drops and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help by calling 911. Alternatively, you can contact a poison control center for assistance. In the U.S., you can reach out to your local poison control center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center. Symptoms of an overdose may include drowsiness, slow heartbeat, dizziness, and fainting. It's crucial to seek help if you suspect an overdose to prevent any serious complications. It's important not to share your Ephrine nose drops with others, as using the same container can spread infection. There are various nasal decongestants on the market, some of which don't require a prescription. It's best to consult with your doctor or pharmacist to determine which product is most suitable for your needs. Ephrine nose drops are used to relieve nasal congestion caused by allergies, hay fever, and the common cold. They work by narrowing the blood vessels in the nasal passages, which reduces swelling and congestion. This medication is for use in the nose as directed, usually 2 to 3 times a day. It's best to use it at the same times each day for the best effect. Be sure to follow the dosage instructions carefully, and do not use more often or for longer than directed. If your condition does not improve after using this medication for 3 days, or if it worsens, consult your doctor. Make sure to check the storage information on the package and keep the nose drops away from heat and light. It's important to keep all medications out of reach of children and pets. Do not dispose of the nose drops by flushing them down the toilet or pouring them into a drain unless specifically instructed. When the product is expired or no longer needed, make sure to properly discard it. If you have any questions about how to dispose of the nose drops, consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.